Aaron, by the way, you should know, is also asking each of us to whom we would donate $10,000 as part of this. And I've chosen Sheway, which is an organization in Vancouver, which supports 300 pregnant homeless women in the downtown east side to be able to keep their babies and live healthy lives. So thank you, Aaron, for that. So we're all here because we all care about healthcare. That's why we're here. We care about the system. And for, I think, all of us, we feel like it's something that differentiates us from our neighbors to the south, when we often feel like there's precious little difference between us, although maybe not these days. And when we think about healthcare too, we think of it as a way to be equitable and to share with the people in our country. That's why we're here. But how do we save it? Because we are in the worst healthcare crisis that we've had certainly in my lifetime. And I think that the healthcare system is about to buckle if we don't figure out how we're going to deal with it and try and fix it. We have to fix this system. And we know that because we've had hundreds and hundreds of commissions and groups that have looked at it and told us almost all the same things that we need to do to fix it. And we've tried to fix it over the years. Some of those fixes have happened in different provinces in different ways. Very few of those have stuck. And so what we've done is we've decided the way to fix it in Canada is to just give it more money. And that hasn't worked. And my argument to you tonight is that we need real, profound reform in our healthcare system, something that we haven't tried in Canada, but it's being tried around the world, if we want to make sure that this system continues to work. Because healthcare budgets in provinces across the country eat up about 40% of all the revenue that governments spend. And governments are now cutting education in order to pay for healthcare. A healthcare system that was designed for the 60s, when there were a lot more young people than there were old people. A time when complex care wasn't something that was nearly as complex as it is now. A time when technology was different. A time when drugs were cheaper. All of those things. But we still have essentially the same system in Canada today that we had in the 60s. And we can't pay for it anymore. We have about 11 great healthcare systems in the world. The Americans is the 11th. It's the most expensive and it has the worst outcomes. Ours is 10th. And we spend just about more than anybody else in the world. And I think what we need to do is think about how we introduce some competition into the system. And the competition doesn't have to be just from the private sector. We can create competition within the public sector if we can create accountability within this public sector. If we can measure the public sector, we have ways to work together. So I'm just going to give you 4 last points, Bill. The first is this. I think will frame the debate. First, we have to admit that in Canada the system is broken and we're prepared to do something to fix it. Second, we have to stop thinking about the only alternative to Canadian healthcare is the American one. Europeans are doing way better than us, and they have systems that are mixes of public and private. We have to remember that a public hospital-based system doesn't have to only be public or private. It can be both. And we have to allow choice where government monopolies exist so that patients and workers can decide where they want to be, and in doing so, create the incentive for our public system to try and do better. 2 minutes, 3 points. The first is the shortages of doctors and nurses are actually a product of government monopoly. Governments decide across the world, in the Western world, how many medical spaces we create and how many nurses spaces we create. In the UK, they're talking about doubling the number of medical spaces that they have to try and create some capacity in the coming years. That is exactly an example of how government monopoly creates shortages. So that's the first thing. The second I would say is we did an amazing job in Canada in collaborating when it came to the pandemic. But so did Britain. And they have a mixed public-private system. And so did other countries in the world. Not all of them, but many of them are equally proud. And it wasn't a function of having public and private. I think it was a function of having countries that care about social equity like we do in Canada, like they do in the UK, like they do in France and Germany, Sweden and Denmark. And the third thing I would say is that competition between the public and private sector doesn't mean that the private sector is always privately funded. The shortage of doctors is not the product of a private-public mix or having competition between the two. We know that because in Europe they have an acute doctor and nurse shortage, and almost all of their systems are a mix of public and private. And so the problem is we have a doctor shortage and we have a nurse shortage because governments around the world, the developed world, have not educated enough doctors and nurses. And if we want to solve this problem, it's not by even thinking about this issue of public and private, which is totally unrelated. The problem is there aren't enough of them. We need more, we need to educate more, and that's a government decision that we have failed to make over many, many years. When we created the First Nations Health Authority in British Columbia, we had no idea, we'd hoped, but we had no idea it would be as successful as it was. But one of the things that makes it successful is that it isn't weighed down by hundreds of thousands of bureaucrats. We are doing worse compared to the rest of the world than we were before, and we've run out of money, I would argue, to pay for it. We need to start thinking about different models, maybe like the First Nations Health Authority, but maybe like the one they have in the Netherlands, maybe like the one that they have in Sweden, maybe like the way that they handle healthcare in the UK. Everybody else, as Sean says, does it differently. We stand alone in what we do, and except for the United States, we are the worst in the Western world at what we deliver for the people of Canada. I asked my son, he was at the school debating team, and I said, well, so what's your best advice? Because this is the first time I've had a civilized debate, probably in my entire career. And he said, well, we all know that you can't be nice, so just be on time. So I totally agree with Tom that the whole thing is about results, because it's all about people. It's all about citizens. What we get out of our healthcare system that's so precious to us and that we pay for, 40% of our provincial healthcare budgets, it really matters for people. It isn't just a numerical calculation, as I know both everybody on the stage would say. And I would also say, though, when we think about healthcare, I try and remember this, that we have to find ways to make our system be more accountable to the people who pay for it. And that's one of the most important ways to make sure that our system works better. Because if you go to most hospitals, in most provinces, you ask most premiers or most health ministers, how much does a heart operation cost to do in the Lower Mainland? They would not be able to tell you. If you ask them how many patients die on the operation, well, they may be able to tell you that. That they may be able to tell you. If you ask them, as I said, how many patients return with a post-operative infection and end up costing the system a lot more, they would not be able to tell you. It's true, as Daniel said, that there was a lot of private healthcare in Canada. Dentistry, pharmacare, MRIs if you're lucky in the province that you live in. Lab results. There's lots of private healthcare in Canada. There's lots of private healthcare in countries in Europe as well. But why is ours more expensive? Why is ours less efficient? Why is ours getting worse results? It's all because we put so much money into a hospital-based system that is unaccountable and I would argue unreformable without introducing some competition to it. We can't even have a civilized discussion outside the C.D. Howe Institute about whether or not healthcare is working and whether or not we can have competition.